What's going on, everyone? It's Alex here from Aleks Physio. So today we're going to be chatting about the 3 levels of treatment for back pain. Welcome. For those of you who are new to my channel, my name is Alexander Kravich. I'm a physiotherapist in Vancouver, British Columbia, and today we're going to be chatting about the 3 levels of treatment for back pain. So let's get into it. The levels of treatment are classified in terms of least invasive to most invasive. So the first level is your conservative treatment. This is going to consist of things such as pain medications, physiotherapy, and time. So pain medications, obviously I'm not a family physician, so I wouldn't be able to prescribe or tell you in as much detail about the appropriate medications for your pain, because it depends on a bunch of different factors in your past medical history, allergies, things like that. However, for individuals who have leg pain or sciatica-like pain with their back pain, sometimes there are recommendations or a medication that comes up to mind as gabapentin or Lyrica, which are anti-seizure medication or anti-convulsant medication that are defined as nerve stabilizers or help to calm down some of the shooting pain that individuals have in their legs. So that is one type of medication. There are other types, obviously your Tylenol, your Advils to help with inflammation, Tylenol to help with pain control. There are your opioids like your hydromorphone, morphine. Obviously this needs to be chatted about with a family physician with regards to helping with your symptoms or determining whether or not medications are appropriate for you if you have back pain and associated leg pain. And then it's important to be mindful that medications would be the adjunct. So the main thing that would be helping with your symptoms would be the time, because most cases of back pain tend to resolve in up to 90% of individuals within the first few weeks to 6 weeks, and sometimes up to 3 months after the initial injury. So interventions such as physiotherapy, which can be started right after the back pain episode, as long as there are no other red flag symptoms, things such as exercises to work on your strength, your flexibility, your nerve health or neurodynamic exercises, your cardiovascular fitness, pain control strategies, graded exposure, so movements that are provocative, done at a level that you can tolerate and slowly progress into are things that we recommend early on in treatment to try to restore some of that mobility and that function and help with your overall back health and helping you to return back to your day-to-day activities. So again, these can be combined simultaneously. It's not like you should just not do anything for 3 months hoping that it gets better. It is important to continue to work on some exercise and see a physiotherapist based on what kind of pain you have, what is causing the pain. It may be beneficial to get some form of imaging, whether that be immediately after, depending on what is going on, or up to 6 weeks after. Again, depending on what's going on, and because most cases tend to resolve on their own, it is difficult to recommend right away having imaging, because obviously in the early stages everything is quite irritable. But long story short, this would be number 1. So conservative treatment, least invasive, physiotherapy, time, and medications. Number 2 is injections. So injections are usually consisting of lidocaine and cortisone, and the injection is being done at the level where the symptoms are provoked or based on what the imaging shows. If you have had an MRI done or a CT scan done to show what is going on at those levels. There are a couple different types. There's a facet joint injection, which is done in the facet joint region of your low back, which are the joints around your low back area. If there is some evidence of inflammation or arthritic changes, and the goal of it is to try to decrease the inflammation to allow you to be able to participate more in physical therapy and your exercises, so that you have a bigger window of opportunity to do a little bit more. The other type is a epidural injection. So this can be done caudally, so at the bottom of your low back, or it can be done at certain levels. And this is more of like a shotgun approach, where you inject this cortisone into the spinal region, and the goal is that the cortisone is going to help and disperse around that area to try to help with the inflammation. And then the last one is a selective nerve root block. So a selective nerve root block is basically where if you have leg pain that follows a distribution, so maybe an L5, so the pain is going down the side of your leg, or an S1, so it's going down the back of your leg into your toes, and it hasn't really been getting better with physiotherapy in time, and you can see these changes, or there is compression of that nerve at those levels and it matches with your symptoms, then sometimes a selective nerve root block can be done on that side as both a therapeutic and as for diagnostic purposes to see if that's going to help with your leg symptoms, not necessarily your back pain, but the leg symptoms that you have. And if it does relieve those symptoms and if it eliminates it altogether, then obviously that's a good sign for us to say that that is the area that is causing some of the symptoms. And that can sometimes be used by a spine surgeon to determine whether or not you may be an appropriate candidate for surgery should you start to have decreasing effects as you have more injections done in that region and the effects last for a lesser period of time and you've exhausted physiotherapy as well. That's when surgical consideration may be looked into, and this would be option 3. So the most invasive option is surgery, and this can be in the form of a laminectomy where they take a piece of the bone out to try to free up the nerve if you're having the leg pain. It can be done in terms of a fusion where they fuse the segments to try to limit any mobility that's happening around that region. It can be done as a discectomy, so if you have pain because you have a disc herniation in that region that's irritating that nerve that's causing the leg symptoms, and then other forms thereof. Of course, I'm not a spine surgeon, so this would be a conversation that you would have with the spine surgeon that you are being referred to. It's important to note that individuals with back pain generally don't undergo surgery or are not appropriate for surgery if there is no pathology associated with it. So what I mean by that is if there's no leg symptoms associated with it. And what I mean by that is that because there are so many structures around your low back area, it would be very difficult to do surgery just for back pain because you would be unable to know what is the structure that is causing the symptoms. There are a few cases when surgery for back pain is warranted, such as if there's been a trauma and you've had a fracture that has been displaced, if you've had a spinal cord injury, and then the other one would be if you have a spondylolisthesis, a movement of one vertebrae on the other vertebrae that is causing your back pain and then also is causing leg pain. These would be 2 cases where surgery may be indicated, but even with the spondylolisthesis, people can have this without actually any findings. So it would have to be quite a significant one. So grades of 2 or 3 or 4 on the 1 to 5 scale if there is any form of instabilities. Instability, trauma, and then also infection would be 3 reasons where surgery may be indicated if it's just back pain. Your other typical back pain because of degenerative changes like degenerative disc disease or arthritis of your back. This isn't something that generally warrants surgical intervention just because of the fact that, again, there are so many structures in the spine that it would be very challenging to know what structure is causing the symptoms. And of course, spine surgery is a major ordeal, so it's important to make sure that the appropriate efforts have been done prior to in order to exhaust all options and to actually see if that would be warranted. Now, of course, this may depend on where you are in the world because in some cases, surgery may be done more readily than other places. So this would just be something to take into consideration. So there you have it. We went over 3 different levels of treatment if you have back pain and leg pain that is coming from your back. We went over the least invasive, so conservative, the second most, which is injections, and then the most invasive, which would be surgery. So hopefully you found some value in this video. Do you have back pain or do you have sciatica pain or any form of spinal condition? Let me know down in the comments below what has worked and what hasn't worked and what your experience has been like with the medical care system. And if you find value in my video, consider checking out some of my other videos where I go over various physio, medical, and exercise related topics. I have over 450 videos going over these aforementioned topics. And if you still find value, consider subscribing to my channel. It really allows my channel to grow and allows me to reach a wider audience. Until then, we'll see you in the next video. Thanks for watching.